Good morning. This is Dr. Tarek. Today my topic is medical terminology of eye. We already discussed anatomy and physiology of eye. Today medical terminology. Number one word root is ophthalmo. Ophthalmo means eye. Ophthalmoscopy, internal visual examination of the eye. Ophthalmology, study of the eye. Ophthalmologists, specialists who diagnose and treat the diseases of the eye. Next word root is opto. Opto means vision. We might have seen optician shop in the market. Optician is the one, he is not a medical doctor. Optician is the one who grind the glasses and make glasses for you. Opia. Opia means vision. Cerato means cornea. The central part of the sclera, which is transparent in front of the iris, that is transparent part of the sclera. This is known as cornea, and the word root for cornea is cerato. Keratitis or radial keratotomy. Radial keratotomy, we give radial incision in the cornea in myopia. Next word root is blephar. Blephar is eyelid. Blepharosis, drooping down of the eyelid. Blepharitis, infection of the eyelid. Blepharoplasty, surgical repair of the eyelid. Dacrocyst, dacro means tear, cyst means sac. So there is a sac in our eye that produces the tears. That is known as dacrocyst. Dacrocystitis. Dacrocystectomy. Stye. What is stye? Stye is infection of the base of the eyelash. It is also there is pus at the base of the eyelash and surrounded by reddened area. That is stye. The treatment is remove the eyelash and squeeze the pus out. It will be fixed. Clean with distilled water. Next word is sclerosion. This is infection of the sebaceous gland in the eyelid. A small swelling, tumor-like swelling is made on the outer side of the eyelid. This is known as sclerosion. Presbyopia. Presby means old age. It means weak vision, weak eyesight due to old age. The muscles become weak, which help in accommodation, and the lens is less elastic now. So vision is weakened in the old age. Presbyopia. Presby means old age. Ametropia. Ametropia means dim vision. Dim vision. Next word is phaco. Phac means lens. Phac means lens. Phaco means lens. Lensoplasty. Next word is sclero. This is outer layer of the eye, sclera. Sclera, outer layer of the eye, which is also known as white eye, white of the eye. When we see into the eye, we see two parts. Central part is colored, that is iris, and the rest of the eye is white, that is sclera. Choroid, choroido, word root for choroid layer. That is the middle layer of the eye. It is full of blood vessels and supply blood to all the internal organs of the eye. Number 3 is retino. Retino means retina. This is the innermost layer of the eye. It is the most sensitive layer of the eye. It contains rods and cones, rods for black and white vision and cones for colored vision. The image should be focused right on the retina. That's how we see a clear vision. Glaucoma. Glaucoma is sometimes the lens become sorry. It is a painful condition of the eye due to raised intracranial pressure. Vitreous humor is being produced in the interior of the eye and it is drained on the side which has trabecular meshwork and a canal of Schlem. If the angle become narrow or the trabeculae become blocked, the aqueous humor is not drained out. It keep on accumulating in the eye and raise the pressure. As we know, retina is a sensitive organ, very sensitive organ, so it is very painful. Next word is cataract. Cataract, the normal pressure of the eye is 12 to 21 millimeter of water. 12 to 21 millimeter of water. Cataract is haziness of the lens. Lens should be clear so eye light can pass. If it become hazy, the vision become dim or maybe almost zero. In that case, we have to remove the lens. When we remove the lens, this condition is known as aphakia. Fake, I told you, it is a word root for lens. A is no without. Aphakia, no lens. There is no lens in this patient. Pseudophakia. Then what we do, we implant a fake lens in the eye of that person. This condition is known as pseudophakia. It means this man or this girl's original lens has been removed and the artificial lens has been implanted in the eye. This is known as pseudophakia. No lens, aphakia. Artificial lens is there. This is known as pseudophakia. Next word is lensectomy with new lens implant, IOL. This new lens that we implant is known as intraocular lens, IOL. Next word is glaucoma that we already discussed. Scotoma. Scotoma. Scotoma is a blind spot surrounded by a normal vision. Scotoma is a blind spot surrounded by a normal vision. Macula lutea. When macula lutea is present in the center of the retina, direct behind the pupil. It is the area of sharpest vision. Here we have the sharpest vision. Macula is spot, lutea is yellow. So this is the yellow spots exactly in the center of the retina. And in this we have another pit-like structure. This is known as fovea centralis in the macular lutea. Fovea centralis is full of cones. So this is the area where we have the sharpest colored vision. Macula lutea, center of the retina, we have the sharpest vision, black and white. And in the macula lutea we have another pit which is known as fovea centralis. Here we have abundance of cones, which is for reception of colored vision. So here we have the sharpest colored vision. Papillary edema. Papillary edema is a word used for the edema of the place from where the optic nerves start. If that become inflamed and edematous, it is known as papillary edema. Synechia. Synechia is Addition of the iris with any of the surrounding structure. Addition of the iris with any of the surrounding structure. Entropion. Entropion is inward inversion of the lower eyelid. Inward inversion of the eyelid. Entropion. And ectropion is outward inversion of the eyelid. Entropion, inward inversion of the eyelid. Ectropion, outward inversion of the eyelid. Strabismus. Strabismus is another name for squint. Both the eyes cannot be directed parallel to the same subject. This is all for medical terminology of eye. Thank you.